This idea that older adults can't change is wrong. Older adults benefit from substance use treatment even more than other age groups, and treatment works. And this is one of the most hopeful findings, both clinically and in the research, is that older adults do benefit from treatment for problematic alcohol use. They're more likely to stay in treatment and complete the full treatment protocol. They tend to have better outcomes, and especially if that program is tailored to meet the unique needs of older adults. Some ways to tailor alcohol use treatment or substance use treatment to older adults have to do with the conversations that are started around isolation and loneliness, life transitions, loss, dignity, etc. And even practical things like the length of where the group rooms or the meeting rooms are from the waiting room if the person uses assistive devices for walking, or the size of the print on the materials like large print materials, or the pacing of the programs themselves. But of course, what works best is a non-judgmental relationship and human-centered approach. And I think especially when it comes to working with older adults, to begin to challenge some of the ageism that keeps older adults out of care or even believing in their ability to change. The idea that people are stuck in their ways or are rigid, when in fact that is not true. Older adults, as you've seen, have great treatment outcomes with substance use treatment. And so for clinicians to hold hope that change is possible, and indeed that is one of the common ingredients for what makes therapy and mental health treatment work in the first place. Along with unconditional positive regard, there's hope and belief in the person's ability to heal. And as it relates to older adults, this is really important because I like to say there is no expiration date on healing, transformation, and growth. And the research proves it. I'm Dr. Regina Kepp. I'm a board certified clinical psychologist and geropsychologist, and I founded the Center for Mental Health and Aging. And this is your weekly mental health and aging tip.